I was diagnosed in '84 when I was 34, actually. And I was first diagnosed with depression. I had trouble staying awake driving any length of time. And the doctor, after tons of tests and everything, it was depression. I just wasn't sleeping as well as what I needed to be. I was under a lot of stress, working a lot of hours, and I was just very, very depressed. I had depressive bouts, but then when I'd come out of depression, I would go sky high the other way and diagnose me with bipolar disease. And got on some different medication, and then I struggled with the bipolar diagnosis. It seemed like it was situational, so if I felt like with enough counseling and medication and everything, I could get better and take care of the situation that was at hand. But it didn't work. I mean, I still have the bipolar disease. And the one time I was in the hospital, they gave me a 3 different new medications. And after being there 3 weeks, they were going to discharge me, and I started to have trouble with my eyes closing and not being able to open them up. I went over to the KCI clinic, and they discovered that I had, it's called a blepharospasm apraxia, and they don't know the cause or the cure for it, but it's involuntary closure of the eyelids. And I have special glasses now that have little crutches on them that hold the eyelids up, and that works some of the time, but when it doesn't work, I'm blind. One of the biggest thing that has helped me is my faith. So I had a church family and a few relatives that kind of hung with me and helped me. But I think that hope is what really got me through. After I started getting better, I wanted to help people, and so help them and to show them and teach them some of the things that I had learned through the years that I had suffered with the depression and bipolar. And so started volunteering places, and it helped me. It helped me to get me a routine down. So I was getting up in the morning and having something productive to do. Got the peer training, and also got benefits training. So I've worked at several places with those skills, and hopefully I've been able to help some people understand disability. Part of being resilient for me and is always having that hope of getting better. I have this inner wanting to help people, and I can't help people if I'm sick in bed. And so I have to get up, and I take my electric chair and I go where I want to go. And whether it's on the max or if it's pouring down rain, I put on my rain gear and we go. So I think that's kind of the resilience is the hope for something better.